Welcome back. This is our big stories on the AM show. Now, today we want to look at World Health Day, which is actually today, a day set aside for global health awareness on the theme, Healthy Beginnings, Hopeful Futures. And we want to discuss the issues with the country representative of the World Health Organization, Dr. Frank Lule, and he's in the studio with us this morning. Doc, welcome to the program.
Thank you very much for having me.
See the conversations, Ben.
It's good to have you in the studio.
Doc,
Thank you.
on this day, why is it crucial that we even have a day like this to talk about health and all related matters?
World Health Day is an opportunity for us to actually celebrate the progress that we have made over the years. But at the same time, it is time to make the call for action for areas where we have not really reached the targets we would have loved to have. And the theme for this year of having healthy beginnings and hopeful futures, I think is very appropriate. Yeah.
We talk of healthy beginnings, hopeful futures, and all of that. In Ghana, we've had our own struggles, from malaria to TB to even cholera in recent times. If we could situate the conversation here a bit before we get to other matters, what would you say about our health in Ghana as a country?
Ghana has made very tremendous strides towards achieving universal health coverage. If you look at where we've been, for example, since 2000, 20 years ago, using your case of, say, malaria, the country is now thinking of elimination. 20 years ago, malaria was the largest killer, especially of young children in this country. We still have outbreaks. You've talked about cholera. But if you look at where we were probably 15 years ago and the response and the number of people we used to lose, I think we are in a much better position now. So to me, this is a very appropriate day for Ghana to celebrate the challenges, rather the successes that have been made. But at the same time, as I said, we still have a long way to go, and we really need to address those issues that affect us.
Well, since today is also a day to commemorate the founding of WHO, let's start from what you can remind us of the mandates globally and what you specifically hope to achieve in Ghana. What is the mandate of the World Health Organization globally? And specifically on Ghana, what do you hope to achieve here?
WHO was set up in 1948, and Ghana became a member the moment it gained independence. Our largest mandate is really to provide health for all. And as WHO, we provide strategic partnerships, support to member states, because we are not the implementers. It is the countries themselves that take on the role of providing health services to their populations. We, as WHO, we provide the technical support, we provide the tools, we provide the guidance, the evidence, and the best guidelines that countries can use to serve their people.
Okay, so in that context, technical support and all that, how closely do you work with the Ministry of Health, all the agencies really under the health sector? How closely do you work with them in achieving these goals that you have set for yourselves and for the country?
Ghana being a member state and WHO being the secretariat, so to say, of the member states of the organization, we have the strategic partnership, particularly with the health sector in Ghana and in the Ministry of Health and all its agencies. But as you know, health goes beyond just health services. It covers all sectors. So we work with other sectors and agencies as well to make sure that we provide the best care that is possible for our populations out there. With the Ministry of Health, probably if you look at it from a strategic point of view, we provide policy dialogue in development of policies, national plans. Right now, as we speak, the country is implementing the roadmap towards universal health coverage. And in there, it has also the medium-term plans. So we support in that area. Then we also support in providing funding where it is required. It's not our main role, it's really just catalytic support. But I think one of the areas that we have worked very well with the Ministry of Health is in addressing these emerging health challenges that we have faced over the years. You spoke about cholera. Earlier this year, we have been with meningitis in the northwestern part of Ghana. And we have many outbreaks. Dengue fever is with us. We have to deal with it. Ghana did exceptionally well when we had the COVID outbreak. So in that area, we work very closely with Ghana Health Service, the Ministry of Health, and indeed other health agencies. The area where WHO really adds value is in the strengthening of systems of the member countries. Because a country with weak systems is not resilient enough. Every time there is a shock, it's really going to affect the population. So that is really our biggest mandate, to make sure that countries have strong systems that can address any of the shocks that may come. And it's not a matter of if, it is a matter of when they will actually come.
And if you contemplate, for example, COVID-19, it exposed many countries, including in Africa, about how prepared we were for dealing with pandemics and all of that. There's been a lot of talk about even producing vaccines right here on the continent of Africa. Ghana has been, at the forefront of that. But what then would you say has been your impact in terms of helping Ghana get to universal health coverage? Because that's a goal we have. We're still not there yet.
Yeah, as a country, we are not on track. But as WHO, we are working with Ghana, as I mentioned, strengthening the systems, but also advocating and promoting public primary health care as a platform that is really going to get us to universal health coverage. This is an area where there wasn't a lot of investment, and yet we know most of our people that require these services happen to be far away from the systems that we have set. Ghana has taken on a very good policy of decentralizing health services, and we are supporting them in that area. So primary health care, we believe, is the platform that is going to get us closer to universal health coverage. And that's what we as WHO are promoting and supporting the country to achieve and implement.
Sweetie started talking about the theme. I wonder how maybe the theme would feed into the continent and our plans going forward.
The theme is healthy beginnings and hopeful futures. And this year, the focus on maternal health and child health is, I think, one of those, I must applaud those who chose the theme, because if we do not have a healthy beginning, and here we are not talking just about survival, we are talking about thriving, we are not going to have a hopeful future. And this begins with having a healthy mother. And to have a healthy mother, sometimes we only think it is really just making sure they have access to health services. But we could take it a step further and really look at the rights of the girl child. Does this child have a proper education? Do they have economic empowerment? Do they have legal protection? And do they have access to medical services? Once you have that, you are really creating a very healthy beginning for that child. They're empowered to take decisions. They are kept in schools longer to avoid these many teenage pregnancies, for example, we are experiencing. So that will give a healthy beginning to the mother in the first place. Then the mother, when she's pregnant, she has to be given the best care during the pregnancy, during conception, rather during delivery, and also after delivery. And that means Ghana must have quality services. But it starts in the household. We recommend up to, like, say, 8 visits to the health facility during pregnancy. And this is mainly to check on the mother's health and if the child is fine. So that is important. During delivery, do we have the services that are going to make sure that we have a successful and positive outcome? But also after delivery, we have to think of the mother. It's really a big transition. There are so many hormonal changes. You're beginning to breastfeed and all that. How do you go through all that? And then the child itself, how do we provide, for example, immunization services to make sure this child is healthy? When the child is sick, do we have the quality services to make sure we are able to treat this child? And with that, and in addition to other sectors coming in, we will definitely have future, hopeful futures for development of this country.
I know we are making some progress. I read, was it over the weekend, about one of the hospitals in the Western region who've not recorded any mortality, maternal mortality. And so I know we are making some progress,
yes,
but there are some gaps that exist. So from your perspective, how would you assess, because you're mentioning child health and all that, how do you assess how we're doing, and strategically, how can we amplify the impact of the work that we are doing in terms of maternal, child health, all the things that you mentioned, legal assistance to the girl child and all that, so you ultimately attain universal health coverage?
I think that's a very good question, because the successes are there. Yeah. Using the figures that we have, I think in 2000, maternal mortality for Ghana was more than 400, almost 500,000, 500 to 100,000 live births. We've gotten to less than 250 to the figures that we have. But that is way off the 70 per 100,000 that we target to achieve by 2030, which means we have to redouble our efforts. What Ghana, as I mentioned earlier, I think there's really been significant investment, not only in teaching hospitals, regional hospitals, but also district hospitals, polyclinics, the CHIPs, almost all levels. There's been some, and now what I haven't been in Ghana for very long, but this year the country has been going through various reviews of their programs. And maternal mortality is their number one indicator. Every time there is a mortality, there is an audit to really see what went wrong. Okay. We have the challenges, and the challenges usually stem from the decision to seek care if you have a problem. There is a challenge of actually the distance. I have a problem, but how do I get to it? And then there is also the challenge, once I get there, will I get the quality services? And all those have been identified, and there is work that is being done. It's not over. We still have a lot more to do, but I'm very positive on what is going on.
Okay.
Are you positive, though, just a quick follow-up, that by 2030 we can get there? At least per the maternal mortality statistics, 250, like you said, since 2000, we've come far. We've halved it, 500 to about 250. But can we get to 70 by 2030?
That's a good question. I wish I was with the Ghana Health Service. But we have it all in place. Okay. If you look at the health workforce, the investment that has been put in really making sure that all mothers get supervised deliveries. If you look at the commodities that sometimes we lack, and you mentioned something about the country going ahead and developing its own products, vaccines, for example. Ghana has a very strong regulatory agency called FDA. And I believe once we put all that together and we commit ourselves, I cannot here say we'll get to 70, but I'm sure we'll be very close to it.
That's hopeful. And are there specific activities to mark the celebration today?
There are several activities as we speak. And as I mentioned, it is really us working with a government to make sure that this is recognized. We have to work with communities. I know there are very many press releases the Ministry of Health is going to take on. And just for your information, this year the UN is also celebrating its 80th birthday. So as a UN, whether it is UNDP, whether it is UNFPA, UNICEF, if you look at the challenges of healthy beginnings and hopeful futures, they are all connected. So we will be having serial celebrations, and it's a year-long issue. Earlier on, we had the World TB Day, and there were some very positive results there. We are now identifying more TB cases than previously.
Yeah.
Later this month, we will be having the World Malaria, we'll be celebrating the World Malaria Day. And as I mentioned, Ghana is towards elimination. Earlier on, we had the World NTD Day. There are a lot of successes for Ghana on elimination of various neglected tropical diseases. We used to have trachoma. That has been eliminated in Ghana.
Yeah.
I
don't remember the last time I heard about that.
We used to have a sleeping sickness, which is trypanosomiasis. That one has also been eliminated.
Polio even.
Polio.
Ghana is polio-free.
So there is a lot. And we are working towards their diseases like lymphatic filariasis, which is this elephantiasis, onchocerciasis. All those, we are moving towards elimination. So we are going to be tagging on to, during celebration of many of these events, also to highlight the birthday for World Health Organization. Now, the month of May has been designated by government as mental health. It's a purple month. Mental health is one of the big challenges that we are facing, and unfortunately, it's not very much recognized. And even where it is recognized, there is a lot of stigma. So we're dedicating the whole of May to also address mental health issues. So as we go along, we'll be looking, and I think towards the end of the year, HIV is still with us. We have the World AIDS Day, and this year, for the first time ever, Ghana will be hosting the International Conference on AIDS and STDs in Africa, which is a very big event that covers more than, it brings in more than 10,000 delegates. So Accra is going to be busy this year.
Yeah. And I want to stay on mental health for a bit, although it is next month, May, that it sets aside to celebrate and commemorate. How would you say that Ghana as a country are tackling mental health? I know that we've come far, we've made some progress. Now people can openly talk about their challenges, seek help when they have to. But do you think that we are still playing catch up to the rest of the world, or we are actually being strategic with how we deal with our mental health issues here in the country? What do you think?
Ghana, for me, first of all, having a mental health authority was a very big step in having an agency that is really focused and targeted. Ghana has a very clear policy. Ghana now has a nice strategic plan to really address, and there is now tangible investment towards mental health. Ghana is collecting evidence. Now we have an acceptable level of data to really know what the problem is in our country. Those are all major steps. Now, the gaps are enormous because we are coming from very far. And me, that wouldn't still deter me. I feel there is much more to do, but with the foundation that has been set, I think we'll be able to do much more in mental health. We're looking at things like substance use, looking at things like alcohol use. We have suicide amongst especially our youth. And then there are some mental health conditions we don't usually handle, things like depression, anxiety. We always think of the people we find by the streets and so on, but it is in our households, it is in our workplaces, and all of us have a role to play, really.
Let's contemplate some of the ailments or illnesses that thrive on immunocompromised, hosts, if you like. I mean, recently we celebrated World TB Day, and we know that the statistics in Ghana, while we're making some strides, a lot of people, there's a stigma with testing, and some people don't follow the DOTS procedure and all of that. I want to tie that into HIV and AIDS, because there are some linkages. People who get HIV sometimes also suffer, fall prey to TB. If you look there too, you would realize that a lot of people, the stigma is still there, but so many people don't even want to check out. They don't even want to know their status, and that is dangerous. We've had conversations here where our guests will tell us that if they look at the numbers, there is so many more who are not getting tested, and we can't say for a fact that this is where we are. What is the WHO doing to help the Ghanaian health system in that regard?
If we look at the figures for Ghana, for HIV, I think Ghana must be applauded. I know there are times when we always say, yes, it is bigger than what it actually is, but sustaining a low prevalence of less than 2% is something we must applaud, especially in these days of high exposure and people not really seeing HIV as the killer that it used to be. And this must go to our youth. It is really tough. It is even difficult to get investment into awareness or prevention programs because you have to make the case, and some people don't see that case. But going straight to your question of testing, of people knowing their status, I think you hit it when you said we still have that elephant in the room of the stigma, and it is almost for all conditions. But for HIV, I think it is such a big determinant on us getting to know our status. We still have to work on that. And for example, we now have the tools, which we never used to have. If you're positive, there are so many things that can be done. And for you to live a normal life like anybody else. And
the ARTs are there.
Exactly. And to me, I take that as something very positive. The other one is also, in my view, we need to integrate or mainstream HIV management with everything else. I think we've kept this response so much into isolation that is taken as a special case that for you, if I come to a hospital, they are going to do a complete blood count. If I report with a fever, they are going to do all exams and everything. But for the HIV, I require some kind of special steps for me to be able to get that test. Yet, and to me, that is creating another barrier. So I think we really need to mainstream the service of testing. We need to make the services much more available. Ghana has gone very well in decentralizing HIV services. It used to be only in recognized high-level facilities. But now I think almost every district has a treatment center. Testing is our first 95. If we do not get it right, we will not be able to achieve the SDG goals. And we have made the testing. I remember when I first tested, as you can imagine, probably you are not.
I wasn't born. It's okay. I wasn't. Yeah.
It would take you 2 weeks to get your results. But now you can even do the test in your house, in your home. Yes. You can do it in the workplace and so on. And so self-testing, we have it. We have various service delivery outlets. We have so many people you can talk to. So I think that is something we can all work on together. And to me, it is not going to be the health workers or the specialists. This is where you see the power of civil society. This is where you see the power of people living with HIV, sharing their experiences, what they've gone through, how they've been empowered, how they can help others to also come out. I think we need to tap into that force, into that power. And then we all need to work with all programs. There are times now we are facing non-communicable diseases. You go there providing cancer services, diabetes services, but they're not doing anything about HIV. And this is the same person. So I think there is a lot that we need to do if we really put our heads together. And that's why I like, to me, this theme for today of having hopeful futures. We really need to call ourselves back to action, find new ways of working to achieve the targets. Because I've never seen a time when we have so many tools at our disposal to make a difference.
You mentioned that we have the tools. I wonder if that's the reason why most people aren't as scared of HIV as they used to be. Growing up, I remember we had HIV clubs in the schools where constantly we're creating awareness about the disease. But perhaps because we have antiretrovirals and ways to manage the disease, people don't see it as a death sentence anymore. Do you think that's why, we are not as scared of it as we ought to be?
Some of these are unintended consequences on the way we responded at the beginning. I think we created that scare and fear amongst populations. But
maybe now we've humanized
in a way. Yeah.
That is, I think.
So we intentionally created the scare factor.
Yes.
To prevent people from what and now we've humanized it.
I think, yes, I know. Some of them, they may not look like they're things that we need to continue doing. But to me, whatever works, I think we shouldn't take anything off the table.
Okay.
Those clubs that we created, they were for HIV. But to me, they can be used as outlets for all sorts of health needs. Okay. For example, adolescent health, mental health. Why don't you use the same clubs that were created? And that's when HIV will also be brought back.
Okay. My final question to you, though, I know that the WHO has helped train and strengthen the capacity of Ghana health workforce. You mentioned that we have the tools, we are making some progress. Would you say that the workforce, Ghana's health workforce, is actually feeling the impact of all these training sessions that the World Health Organization has been lending to us? Have you seen some significant improvement in the workforce?
Oh, yes. Ghana is in what I would call a position of envy for many other countries when it comes to the workforce. Ghana has really developed a very strong workforce that has supported. I can even start from a selfish perspective. Ghana health workforce has supported WHO a lot.
Ghana health workforce has supported WHO?
Yes.
Okay.
Ghana health workforce has supported other countries in strengthening their systems. Okay. Ghana health workforce has been developed and has, as I've mentioned, has been decentralized to many areas. The challenge comes in here. And I think this is really like you're struggling with your success, and it is with the migration. We are losing a lot of we are losing a lot of health workers to other countries. And you know why? It's because you're good quality. We have very good quality nurses that are needed by almost all countries globally. That is one of the challenges we face. Of course, we also face the challenge of absorbing everybody that has been trained. But I had a chance of speaking with the Ministry of Health. That is really his priority, of making sure that the health workforce in Ghana is absorbed to the extent possible.
Okay.
In these coming days, I think it will be today's Monday, Wednesday, that will be the 9th, up to the end of the week, we will be having a policy dialogue, and it will be specifically on the health workforce.
Okay.
So a lot has happened. WHO has really supported in developing this health workforce. There is still a long way to go, and there are major challenges we need to deal with, like the one I've spoken about of migration. But I think we are in a much better place. And we, as partners, for example, WHO have mentioned, we are already benefiting from that success.
Thank God. Benjamin.
Well, I mean, it's been an interesting conversation. My key worry has to do with the NCDs, the non-communicable diseases, and the havoc they are wreaking. You would notice that we used to focus so much on the malarias and the rest, but now the cardiovascular diseases, for example, stroke, and other things in there. You've mentioned diabetes, cancer, kidney disease now has become, I guess we really need a focus there as well. There is a focus, but looking at the mortality rates, I guess a lot more ought to be done. But that will be my final thought on
No, that's really true. In fact, as we speak now, yes, it is infectious diseases that are still causing the majority of the deaths, but we are now talking more than 40%, almost 45% of deaths are because of non-communicable diseases. And for the first time, I think the country has now come up with strong data on non-communicable diseases. We recently supported the country conduct a STEP survey. This is a survey which is really looking at risk factors for non-communicable diseases. And it brought out really stark issues that we have to deal with on non-communicable diseases. The government has made this a priority. And I really feel this is something that must be commended. When you look at national health insurance, it never used to cover many non-communicable diseases. There is now support from the NHIA on NCDs. When you look at the workforce development, the way systems are now being organized, it's really to make sure that we address non-communicable diseases. We never used to have data systems that would even capture how much we're facing. For example, it was so easy to report on malaria, on HIV, and we couldn't report on non-communicable diseases. But now we have developed an information management system that is able to capture NCDs. So you are right, this is an area we need to focus on. It is now a priority. We can't keep burying our heads in the sand. That is the development for developed countries alone. It is ours here to deal with. Tobacco. Ghana has done very well on controlling tobacco use in this country, and I think it must be commended for that. That is something worth celebrating. You even instituted, I think there is a tax now. There is a tax on tobacco products. And if you look at what tobacco is able to do, cancers, chronic lung diseases, almost every part of the body is hit with tobacco. And I think we need to work on cancers. We need to get a national registry for cancer. We need to work on cardiovascular disease, kidney diseases you've mentioned. There is a lot of development that has happened on. We are seeing a lot more dialysis centers. More needs to be done. But to me, it goes back to prevention, making sure we do not get to a position when we have a high burden of non-communicable diseases. And in my view, it is always the easy things, which may even not sound medical. Wash your hands, eat well, make sure you exercise, live in a comfortable setting, have your personal hygiene.
And you're good to go.
And you're good to go.
Thank you so much, Dr. Frank Lule. He's country representative of the World Health Organization. It was good to chat with you. Thank you.
Thank you so much.
Right. And before we go, every year you do know that thousands of Ghana's brightest minds seek better prospects abroad, leaving a gap in our workforce. And the question is, how can Ghana inspire its talent to stay? Join David Ofosu-Dorte, Professor Mary Setrana, and Her Excellency Dr. Amina Guri Fakim, that's a former president of Mauritius, at the 12th edition of the Ishmael Yamson and Associates Business Roundtable to discuss managing the talent exodus, leveraging private-public partnerships for growth. Now, this is happening on the 7th of May, 2025 at Labadi Beach Hotel, and it starts at 9 a.m. sharp. To register your attendance, simply text your name and organization to this number, 0530-117-202, or you can also send an email to info@ieyamson.com. Ben will tell you more, and then we'll take a break.
Well, that's it for now. We're going to take a breather, and we'll be right back in a bit.